Anyone else wishing to bring a matter before the town board, please raise your hand. Yes, sir. Please state your name and address for the record.
Anthony Bainey, and I live at 21 Eisman Avenue in Tonawanda. Just addressing the board and reaching out to try to get a proposed resolution for the New York Health Act. I know there's been opposition and statements that there's no appetite for that type of action. I think that it's not unreasonable. Again, Buffalo, the city, Cheektowaga have passed the resolution for the New York Health Act. I know Supervisor Emminger's brought up the cost issue. I think.
What is the cost? You know, I'm sorry.
I mean, estimates are around $165, billion.
165
billion.
Billion?
Yeah, with a B.
Okay.
Yeah.
Where'd you get that figure from?
I mean, if you looked at the 2018 RAND study, they were estimating about 150, so I would put it around another 10 since it's been 7 years since they had conducted that study. And in that study, they conducted...
in the 2018 study?
Yeah, the 2018 study, it's by the RAND Corporation. It's about a 125-page report, so... It's quite lengthy, but they did detail from 2021 to 2031, if the New York Health Act was implemented, there would be actually a 2% savings at the state level. So if you're looking at the different cost-sharing options that happen with the New York Health Act and also, the winding down of the private plans, then you get some cost savings. And also at the municipal level, you would have savings also at different like at the county level with having the unfunded mandates not being present. But also, I mean, the board could also pass a resolution. There's a proposed bill in the legislature that would basically implement under the Affordable Care Act. There's the 1332 program, which basically tries to use different methods to expand health care. So it's putting responsibility on the state to come up with innovative ways to expand health insurance. So that's something that the Affordable Care Act provides. So I think there are other bills that are more reasonable that the town could show support for, because I think it is unreasonable for some children in New York State to have no health insurance. I mean, according to most recent studies, there's 2.8% that have no health insurance, and that's not including those who have underinsured, lapses of insurance, gaps of insurance. So I think the town could, make a reasonable resolution and back one of the legislative bills that are on the table. I mean, we're looking at the federal level. A lot of people are concerned about health care. I go...
Including everybody in this room, I would imagine. Healthcare is very, very important to every American. I agree with you. And I commend your passion for this topic. I think your $165 million figure...
Billion.
I'm sorry, I wish it was $165 million.
Don't we all?
For your $165 billion figure might be a little light, and only primarily for this reason. Since 2018, inflation and everything, they've gone up like 20%. You only raised the number, I think 10% maybe.
10 billion,
yeah. I think it might be closer to 190 billion maybe, but it's still a lot of money. Somebody's got to pay for that, right? Right, and there are no free rides, and so somebody's got to pay for it, and that's what I think the state assembly and the state senators, they got to grapple with it, because that's going to be put on the burden of everybody throughout New York State. We don't control that. The people on this board have nothing to do with that. So we if I feel like we're, and I'm just speaking for myself, if I feel like, if you think that I'm just not taking it serious, I am taking it serious. It's just that there are a lot of things we can do in this town. Healthcare costs, controlling healthcare costs across the state is not one of them, unfortunately. And the fact that there are children who are uninsured, that's unconscionable. Okay, everybody, in this day and age, should be insured, and they've been grappling with that in Albany for years. They're grappling with it in Washington, and hopefully they'll come to some consensus. They should have come to a consensus 40 years ago. They should have had this all resolved. and everybody kicked it down the can, and now we're in this situation. So, like I said, I appreciate your passion for it. I saw your letter to the editor today, in the last week in the Kenton Beat. So I was hoping you'd come tonight. Just be a little, try to be understanding people in our position, but it's certainly on the forefront of all of our minds. Okay?
I appreciate your time and consideration. I would just urge you to also consider the bill that's for the 1332 waiver and for that innovative program as well.
Okay. All right. Thank you.
Absolutely. Thank you for your time.
Is that a Senate bill or is it Assembly bill 1330?
Assembly and the Senate.
They're both numbers? Okay.
Yeah.
Okay.
Well, that's for the specific 1332 section of the Affordable Care Act, but I'll get you the Assembly and bill numbers, the Senate, Assembly and Senate bill numbers for those.
Please, yeah, if you can email that to me.
Absolutely.
Thank you.
Absolutely.
Thank you. All right. Is there anyone else wishing to be recognized? Please raise your